Well, good afternoon. We're starting an hour early today to accommodate the governor who wanted to do her presentation at 3 o'clock, but this won't be a long one. I'm pleased to say that nearly every trend is heading in an encouraging direction. What the people of this community have done to knock this virus down has been pretty inspiring. I was last here on Friday, and we announced that we were up to 326 deaths in this community. We had 54 in one day, which was the worst that we have had. Over the last 3 days, we've lost another 67 of our neighbors, and that's a painful thing for this community. But when you look at the trend lines, we are making enormous progress. It's an average of 22 deaths a day. At this point, our rate, I talked about it before, used to be doubling every 3 or 4 days. Now it looks like it's doubling every 10 or 12 days. There is no question the progress we're making is because of the people in the city of Detroit honoring the request for social distancing. We've been doing it without closing our parks. We've been doing it without curfews. We've been doing it because the people of this city have decided to watch out for each other. I've talked to most of the hospital CEOs today. The hospitals are seeing an easing in the number of beds, and I will continue to say this. The ultimate report card of this community and how we handle the coronavirus will be seen at the TCF Center. That if they built 1,000 beds, and that was the right thing to do to be prepared, I've said all along, if it gets above 200 or 250, we did a poor job as a community. Based on the numbers I'm seeing already, they're coming in extremely low. And I'll let the governor talk about that. But what it says is, so far, the city of Detroit saw one of the quickest spikes in coronavirus in the country, but it appears that so far we're doing an extremely effective job of knocking it back down. I was very concerned over Easter weekend whether we would see clustering and undo all the progress, but as Assistant Chief White will talk about, we had good cooperation. We're going to have to stay with this. We need to wear our masks for a couple of more weeks. We're going to need to follow the social distancing rules, but we have made progress, I think, more than anybody of any of the projections we saw has been the most optimistic. Our testing site today is being closed down for the afternoon. I think we have reached everybody, but we have high winds this afternoon, and we don't want the tents blowing over and anybody to be at risk. So I think we have reached almost everybody to reschedule them either for the morning or tomorrow. But if you're listening to this and you're on your way down to the fairgrounds, we're shutting down for the afternoon to avoid the risk of the high winds. We will get you in tomorrow if you go home and call. But again, the numbers continue to be remarkable. Between the fairgrounds and the Abbott Lab testing, tomorrow we are going to do our 10,000th test conducted by the city of Detroit. 3 weeks ago, we didn't have a testing program. We didn't have a lab kit. We didn't have a lab. And to have done 10,000 in less than 3 weeks is a great tribute to our partners at Henry Ford, DMC, Trinity Health, Quicken Loans, and everybody who has pitched in. Every single Detroiter who is showing any symptoms can get tested regardless of ability to pay. We are going to be the city where we reach everybody. If you're seeing any symptoms at all of a cough, a fever, or trouble breathing, call your doctor. If you don't have one, go to the city website and get a doctor. We can get you in the next 24 hours and get you tested. That's our commitment to our community, and I want to thank Governor Whitmer, who just added more testing capacity out of a lab in Grand Rapids. And we will be starting to send some of our samples to Grand Rapids within a week, which will give us the ability to expand even beyond 1,000 a day if that turns out to be necessary, but the governor's leadership on that was extremely valuable. As far as returning to work, we've now got 600 police officers back at work, 100 firefighters. We had more than 300 DDOT employees test negative at our 50-minute test site and be back to work. So I'll let Assistant Chief White talk about this, but we've now fully staffed all of our various specialty operations in the police department. For a while, we had to steal from some of the departments to make sure we could make the 911 calls. Now those departments are restaffed. There is one area where we don't have positive news, and that is the nursing home. And it's becoming clear right now that that's where our most vulnerable population is. We went out, Denise Fair's team in the last 3 or 4 days, went through 3 nursing homes, found in 2 of them 30% of the patients tested positive, and 1 of them 50% of the patients at the nursing home tested positive. One of the things that was very concerning was that of nursing home patients who weren't showing any symptoms, nearly 50% of those tested positive. And so you can see what the problems that nursing homes are having. You have people who are positive before they're showing symptoms. We've known this now for a few weeks, but it's very difficult for the nursing homes to know how to separate individuals. And so we are going back behind with each individual nursing home to make sure that those who are positive are appropriately isolated. At the request of Director Fair, we're now going to be committing 240 tests a day for the next 10 days just to nursing home residents and staff. We're going to test 2,400 nursing home residents and staff in the next 10 days, and we will make sure that the nursing homes take the results of those 50-minute tests and separate the patients accordingly. We've lost another 8 of our neighbors at nursing homes since Friday, and we have got to get this nursing home issue under control. Interestingly, we're finding at the homeless shelters the problem isn't nearly as significant. The first homeless shelter we did only tested about 5% positive. And I think enormous credit goes to Arthur Jemison and the entire team, who 3 weeks ago started sending out nurses twice a week to check on our homeless population, find people with high fevers, get them separated, get them medical care. The active response to our homeless population, I think, is going to end up being studied as a national model. We need to start to apply the same kind of testing at the nursing homes. And the other thing that I want to talk about is this. Unfortunately, we don't have the luxury of only dealing with one problem at a time. And we are going to have to, in the next week or two, address the city's financial situation. As I talked about before, we're looking at a deficit of more than $100 million just in this fiscal year that ends at the end of June. We're looking at upwards of $200 million in the next year, which City Council needs to adopt the budget on in the next few weeks. And so between the two, we've got to find a way to address $300 million in lost revenue. We have been very frugal in recent years, and with the great leadership of Council President Brenda Jones and the chair of our Budget Committee, Councilmember Janae Ayers, we've got significant money in rainy day fund, probably upwards of $100 million. But we're still going to have significant issues to address. It's going to affect all 9,000 of our employees. So tomorrow night at 7 o'clock at Channel 10, I'm just going to do a live address to our employees and to the city of Detroit as a whole. And I'm going to lay out the proposals on how we deal with a deficit in excess of $300 million over the next year and a half, and how we manage to do it where everybody is going to have to share in some sacrifice, but we think we can keep the city services intact. And so tomorrow night at 7, we will lay out those details, and we're just going to have to take care of everything at once. It's what we signed up for. It's what we're going to do. We are able to do a lot of these things because we have had great partners. And we started last week giving out masks as surgical masks as people got on buses. And there's been enormous compliance. People seem very appreciative of the fact they can get on the bus now and not be breathing on their fellow passengers. But we did not know how long our mask supply was going to last. And we also need masks to continue to supply our police department, our bus drivers in their terminals, the fire department. And as we were scrambling around the country to stay ahead of the curve, a great friend of this city, Arn Tellem, called up. And he said, Tom Goris would like to help you. What could we do to help? And by the way, we have a source of 100,000 surgical masks. What would that mean to you? And I said to him, well, that would mean the world to us. And so I'm deeply appreciative of Tom Goris and the donation. And with that, I'll turn it over to the man who's running the Detroit Pistons, Arn Tellem. Arn?
Thank you. I'm here on behalf of Tom Goris, who is donating 100,000 masks to the city of Detroit for its first responders and for its employees who are in the front line in fighting the COVID-19 crisis. This is a critical time for the city and our community, and we're really pleased to be able to make this donation, and we're going to continue to work with the mayor to look for other ways we can contribute in the future. And if I might at this point, I just got a text from Tom to the mayor, and I was copied one. I'd like to read it on behalf of Tom. It says, hello, Mayor Duggan, this is Tom Goris. I appreciate everything you're doing for the city right now. Glad we could help with the masks, and I'm sure there will be more things to come. And as you know, we're also working on a complete package to help our city on all fronts. It's a challenging time, but also inspiring to see how people are coming together and care so much, and how you continue to lead. All my best and appreciation, Tom Goris. So thank you, Mayor.
And thank you. And to give you a sense of the Pistons organization, when we were first looking at potential sites for field hospitals in case the hospital capacity were exceeded, first phone call I got was from Arn saying, if you need the Pistons' brand new practice facility for a field hospital to deal with the overflow of coronavirus patients, we will turn it over to you. And it was on our list as prime sites. Based on what we're seeing right now, we're not going to need it, but it was an extraordinarily generous offer. I'm going to turn it over now to Assistant Chief White. I don't know how many more days we're going to have him here. Chief Craig is just waiting for his doctor to sign off, but he's very much in charge of telling us what to do these days. And Chief Craig will be joining me up here before very long. We did not know what to expect going into Easter weekend. What we are finding is that in probably 2/3 of the parks in the city, there are elders in the neighborhood who have said to the young people, you're not going to gather here in large groups. You're not going to play basketball. They don't need to take down the rims. The elders in this community have stepped up in a dramatic way. And across this city, the people of Detroit have been so cooperative. And today, the commanders again reiterated that if the cooperation continues, they see no need for Detroit to have to do what so many other cities have done. They don't see any need to close the parks. The way people are enjoying them, spaced out, is appropriate. And so at this point, for an update on the weekend, let me turn it over to Assistant Chief White.
Thank you, Mayor. Good afternoon, everyone. As I always do, I want to thank the men and women of the Detroit Police Department. I have never been prouder of our men and women and the way they are serving and dedicated to our community. So I want to thank them and make sure I take time out each and every time to thank them for their work. They're showing up for work. They're doing exactly what we're asking them to do. We've returned a number of officers back to patrol. We've had very good luck with our rapid testing. Actually really isn't luck, it's a really good process and it's working very well for us. We've returned approximately 600 members back to work. We're very eager to get back to work, and we've got a number of other officers that are coming out of quarantine or recovering from this dreaded virus. With that, we've been able to return a number of those officers back to specialized commands such as traffic enforcement at the precinct level, our gang intel unit to disrupt our violent gang offenders. We've also implemented or returned a number of those officers to other entities to help support our law enforcement goals. In addition to that, some of those officers are working in our TAC Ops area, where they're keeping an eye on our parks, working with our community, and we've had great success with our community. As the mayor indicated, I want to take this time out and thank the community. We put out the call a couple days ago, about a week ago now, for our community to let us know if there was a problem in the parks, if they had groups congregating, and they answered that call in a big way. They've been extremely cooperative, and as a result of that, we haven't had to do what some communities have had to do, and that is close the parks. We've been able to allow our community to continue to enjoy our parks, but we have had some instances where we've had to take some enforcement action and correct some behavior and break some groups up, and when we've had to do that, that's been met very positively. In fact, this weekend we had a couple of instances at a few parks where we had to break some groups up, ask some people to engage in social distancing, and in some of those instances the officers even passed out masks, and that was received very positively. So again, I just want to thank the community and to let them know that we're all in this together, and we're going to continue to partner with them, and as long as we get that spirit of cooperation, we're sure that we won't have to make the recommendation to the mayor to close down the parks. So with that, I turn it back over to the mayor.
All right. And so if we keep doing what we're doing, we're going to win the battle against coronavirus in the community. We're now focusing a lot of that battle in the nursing homes. And the person who's heading that up is our health director, Denise Fair.
Thank you, Mayor. Again, I'd like to start by thanking our unseen heroes who are keeping our city running and safe. These are public servants who are doing everything that they can to help keep the city safe. So since the first COVID-19 case was detected on March the 11th, all of our lives have changed significantly. As an example, yesterday, many of us celebrated Easter via Zoom. I know I did. Others of us visited loved ones with masks on, and that's our new reality. No doubt we are navigating this world very differently. COVID-19 has become part of our vocabulary, and we are working to slow its spread with extra hand-washing precautions and disinfecting, being more intentional, covering our coughs, wearing masks, and distancing ourselves from loved ones and friends and others. Today, we now have 6,811 confirmed cases and 391 confirmed deaths. And my heartfelt condolences go out to all of the Detroiters in their loss. Now, I realize it may be hard to tell at first glance, but these numbers are indicating fewer new cases over the past few days. This is a good step in the right direction, but I urge caution. Now is not the time to relax our efforts, but to strengthen them even more towards slowing COVID-19 in our community. Now, our seniors are also on top of mind today, particularly those who are living in nursing homes. Older adults and people who have severe underlying medical conditions like heart disease or lung disease or diabetes seem to be at a higher risk for developing more serious complications from COVID-19. And as mentioned last week, the health department is aggressively working towards protecting vulnerable populations. We now have a process in place offering on-site testing in partnership with Henry Ford Health System and Wayne State medical students to provide testing at nursing homes and homeless shelters. The process began last week, and we are testing seniors and staff, both symptomatic and asymptomatic, in all of our 26 Detroit nursing homes within the next 10 days. Again, this is really aggressive. In the next 10 days, we plan to administer more than 2,400 tests. The health department is also proactively monitoring nursing homes and to ensure seniors who have symptoms are cared for and those without symptoms are protected. This is our commitment to the city of Detroit. We're also continuing to support nursing homes with guidance around testing and isolation and recommendations around environmental concerns to diminish further spread in these facilities. We're also ramping up testing in our homeless shelters as well. So a lot is being done across the city to help flatten the curve for COVID-19, and you who are listening are a big part in that effort, along our business community who are also doing their part. So yes, the numbers are headed in a good direction, but we are no means out of the woods. So please continue preventative efforts for yourself, for your families, and ultimately our entire community's survival and safety. As I've said before, this is all hands on deck. This is a team effort, and we are in this together. So let's please stay home and let's stay safe. And with that, I'll turn it back over to the mayor.
And also a thanks to the Detroit Fire Department and the EMTs who are out today taking the samples from patients in the nursing homes, because this is a huge number of patients to get through in a short period of time, and everybody is pitching in together. And with that, we'll take any questions.
Hi, Mayor. John Elliott, New York Times. First, for the Assistant Chief, I think you said 600 members are back to work now. Do you know roughly how many are still out because of COVID-19 quarantine or anything like that?
I'm sorry,
Do you know how many are still out?
We've got approximately 180 still out.
Gotcha. And this question is for both the mayor and the assistant chief. I'd like to get your thoughts on this too. But, obviously folks are coming back and that's going to help, with staffing and stuff. But given that, over the past couple of weeks there were so many people out, and there has to be, some focus on making sure that there's social distancing happening and stuff like that. Is there any concern about, the ability of the department to have monitored and really enforced on other crimes throughout this time?
We've been over this a number of times. I think we're now getting 4 or 5 new people quarantined a day as opposed to 40 or 50. But what the Detroit Police Department did is going to be the roadmap to companies reopening in this economy across the United States. Went to a process where everybody was being tested who had been exposed, went to everybody's temperature being taken when they show up to work. If they're over 100 degrees, they get sent home. I get a text to my phone every single time somebody, police, fire, or DDOT tests over 100 degrees. We set up a program for housing at hotels, for first responders, officers, firefighters, EMTs, bus drivers, who are living with somebody who might be medically compromised, and they don't want to take the risk of taking it home to them, so they're staying at hotels. We have put all of these pieces together. There are social distancing protocols inside of headquarters, and it has dramatically shifted. At some point, somebody is going to do a study. 10 days ago, the Detroit Police Department was reeling at the number of new people being infected. They weren't being infected from the public. It was spreading throughout the department at things like roll calls and lunchrooms and the like. The speed with which everybody moved, Dr. Rob Dunn's leadership and the leadership at the Detroit Police Department has turned that around, and we can share with you all of those numbers.
But as far as any concerns about how effectively you all were able to do your jobs on the streets, was there any worry about how that has gone over the past couple of weeks?
I apologize. I cannot hear.
Not used to the mask thing. Was there any concern about how effectively you all were able to do your jobs over the past couple of weeks, given that, all the burden that you all were under yourselves?
He's asking if you were doing your jobs effectively.
No, I think the officers, as I indicated earlier, I've never been prouder of the work that the men and women of the Detroit Police Department have engaged and participated in. There was no template for this. We had to learn on the fly. We did the best we could until we got our legs, so to speak, and I'm proud to say that what we've put in place, as the mayor indicated, will probably be modeled across the country. Our pre-screenings for our officers when they come in, making sure that we ask them basic questions about their health without being, too far into the weeds, but the basic questions as far as how they feel, what their temperature is, taking their temperature, and then listening to them, and certainly letting them know if you don't feel well, don't come to work. We have a high level of commitment from our men and women. They want to come to work. We want them to come to work, but we want them to come to work healthy. The mayor has allowed us to quarantine our people. We had a number of officers. As I indicated, we still have well over 100 in quarantine. that was, brand new. And having officers quarantine up to 14 days until they got healthy. Now we have the rapid testing. I think all of that together builds confidence in process, builds confidence in leadership, and allows the officers to feel like, number one, we value them and we understand that we need them here, but we also want them to be here healthy. All together, I think, has built confidence in our process, and really no question about us being able to do our job, or if we have the ability to do our job. I think that they showed on a day in and day out basis that part we've got down pat pretty much.
So I just looked up the stats from yesterday. A year ago, the 911 Priority 1 response time was about 13 minutes. The national standard is 12. Yesterday's was 10 minutes, 30 seconds. We haven't been over 12 minutes except possibly one day in the last 3 weeks. It has been a remarkable performance by the Detroit Police Department.
And two more quick things. Some cities, large cities, have reported increases in commercial burglaries during the coronavirus shutdown. Have you all seen that?
We haven't seen that.
You haven't seen that?
No, we haven't.
Okay. And the last thing for you, Mayor, on the buses, I know you all have done the initiative with the masks, but when you still talk to riders and stuff, they're still very crowded. Have you all thought or any way of mitigating that, or those situations of how crowded it gets on the buses?
Yeah, we're looking at whether there might be some routes to run extra buses to ease it a little bit, but the feedback we're getting is that masks has been extremely well received.
Great, thank you.
Just to continue that line of questioning, Jim Kirstner from Channel 7, can the mayor or the assistant chief, are you saying that crime in the city is down overall with the stay home, stay safe? And without getting into statistics or percentages, can you just give us a brief description that the crime is down? How would you describe it?
Violent crime has been up for a period of months, and it's not any different now than it has been the last 3 or 4 months. Property crimes are down. I think that captures what we've seen.
I know you said that the governor was going to be addressing the numbers at Cobo. I think you said late last week that was going to scale up by 25 beds per day. If you want to defer to her on the numbers, does that mean staffing with medical staff over there is in line? They're able to handle what is coming in?
Again, I would say there is less need for the beds than anybody would have imagined even a week ago. And I think there's no question it's because the people of the city of Detroit have been extremely supportive of the social distancing requests.
Does that surprise you that the numbers are like that?
I didn't think we would see 1,000. Now we'll see whether we see 200 or 250. But just being around this city every day for the last 8 or 10 days doesn't surprise me at all. I see people in our parks honoring the social distancing requests 99% of the time. I see people when they're in groups, at least in small groups, wearing masks. I think people in this city have taken the commitment to their neighbors to heart. And I got to tell you, A.C. White and I a week ago Friday thought it was a foregone conclusion we were going to have to close parks. To be here 2 weekends later after Easter and not to have had to do that and to have had the kind of cooperation we had, there are cities all over this country have closed their parks. And here in the city of Detroit, our residents have really been terrific. And I can't tell you how many stories I've heard about the respected person in the neighborhood who walked out to the neighborhood park and told the kids to get off the basketball court without the police having to do anything. That's what is turning the tide in this city.
And can either of you speak to your monitoring, the green light surveillance cameras? Did you have any incidents at all of a church holding in-person services? I know that the governor allowed that, but anything that you watched kind of carefully? Or I think one day last week you did have numbers of instances where you had handed out the $1,000 tickets or had given warnings. Are you saying you're down to 0 incidents now?
Oh, absolutely not. We're not down to 0. But to answer your first question with regards to church, there was no incidents involving churches that were brought to my attention. With regards to enforcement, yes, we continue to take enforcement. But I think what needs to be stated is the cooperation from the community has driven that enforcement down. We haven't had a need to take enforcement at levels that comparable cities are seeing. We've got that great spirit of cooperation with our community. Now, that being said, there's still some pockets of issues where people have to be nudged along to follow the process. This past weekend, we had a number of instances where we made contact with some members of the community where we had to either advise them, and in some instances actually issue the ticket.
Okay, Mayor, I've got a couple questions from the Detroit News. One has to do with the backlogs that you had mentioned last week with the testing, getting the results back. Wanted to know if there's any further information on what was causing the backlogs and whether we think that may be contributing to the lower numbers that we're seeing.
Yeah, today they aren't contributing anymore. So the backlog's been cleared up, and there was a log jam coming out of tests out of New York that's sharing the lab with us that was a contributing factor. It's been cleared up, and the test results are flowing smoothly now. So whatever numbers there are today are accurate. But again, it's all you're measuring are the number of tests being done. So probably across the state, 30% of the people test positive. So if the state reports 2,000 more cases, it just means they did 6,000 more tests. If they did 10,000 more tests, you'd see 3,000 more cases. Again, I keep saying this, the number of new cases is a completely meaningless statistic. Now, the number of deaths is the statistic to watch, and we're seeing that come down, and that's a great relief.
Okay, another question on hazard pay. I think today was the day that the order was supposed to go out and that was supposed to start happening. Did the order go out, and is that?
Yeah, the order did go out, and I haven't seen the letter that went out that was going to the employees, but basically front-facing employees are getting $5 an hour for every hour they work starting today. Firefighters are getting $90 a shift starting today, and you will get a quarterly lump sum, so we'll keep track of it. I can't bring in all the payroll staff today to change the payroll because we'd have a problem with a group of people working together, but we're tracking your hours and you will get a quarterly check, and it has started today.
Okay. Regarding the budget and the conversation you're planning to have tomorrow, WWJ wants to know if there's anything more you can say today, particularly as to whether there would be any impact on public safety.
So I'm going to do this once tomorrow, and the team is working very hard. So if you can imagine this, there is an entire team of people that is dealing with the health response. And there is an entirely different team of people that's dealing with the financial response to make sure the city does not lose its momentum and continues to deliver service. And so we're running two massive efforts at once. And as soon as I get out of here, I'm going to be spending the next probably 30 hours or so finalizing the financial plan, touching base with union leaders, council members, and the like. And then at 7 o'clock tomorrow, after having consulted with a lot of people, I will be rolling out my recommendation. My recommendation will be an order for cuts that take effect in this fiscal year immediately from now through June 30th, but they will also be asking council to adopt the budget, which council has to do for the next fiscal year, which starts July 1st. And hopefully, and again, the leadership on this council on financial matters has been really strong. But these are hard things to do. The last time the city wouldn't face up to it, and we ended up with Kevin Orr. That's not going to happen again. We're going to face up to these financial problems and solve them ourselves.
Okay, for Assistant Chief White, a series of questions from Channel 7 on Project Greenlight and the virtual patrols you talked about last week. I'm going to kind of encapsulate a little bit. They want to know if you could talk a bit about the process in terms of how you identify which locations you're going to do virtual patrol. Is it just city or the business Greenlight cameras, or are there other private cameras, and are there any additional resources being applied to it, or is it existing resources?
Okay, so the virtual patrol process is something we deploy using what we call risk terrain modeling, which is data driven. Basically, in the simplest form, if there is a particular problem that has shown itself in a particular area of the city by virtue of crime, in this instance, we're talking about groups that are, perhaps 10 or more engaging whatever behavior. Deploying that risk terrain modeling, we decide, okay, this is an area that we've seen that problem before, so we're going to do virtual patrol. And virtual patrol is essentially looking at a computer with a trained analyst and looking for that behavior. And with regards to the decision being made, again, it goes back to data. What has the data shown us? Do we have areas in this particular area? Have we received a number of complaints from a particular area that will drive that behavior from the analyst? The second part of your question, again?
Whether or not any additional resources are being required, and if we're utilizing other private cameras or just Project Greenlight partners.
Okay, so as far as the additional resources, I'm happy to say no. By virtue of getting a number of our people back, we've been able to replenish those specialized commands. Our crime analysts, which are primarily civilian, a number of them were out. We were able to return those folks to their assignment, so that's not making a drain on our resources. With regards to other cameras, no, the Greenlight cameras, as you know, is a public-private partnership. We do not use private cameras from private households for virtual patrol or Greenlight activities.
Okay, and I think the last key question is, when you disperse a crowd, are you looking to just have the crowd dispersed, or you're going to be investigating individually the people there, checking for warrants, et cetera?
Well, that's a hard question to answer. It depends on a number of different things. Generally speaking, the officers would like for, all the crowds to disperse upon being advised to do so. Has there been instances where there's been additional investigation based on some of the conduct that the officers have encountered? That would be a factual statement. Yes, there has been. But generally speaking, the idea is to break up the crowd, to break up the activity, and to inform about the ordinance. And the officers have used a lot of discretion in issuing the ticket. We had over 600 instances over the past 2 days, 693 spot checks, 169 warnings, and looks like 35 tickets. So, that speaks to the level of discretion that the officers are operating with. So the idea is to break up the crowd, to inform about the governor's ordinance, and, almost as a last resort, to take the enforcement action.
Okay, unless there are any other questions here, that was the last question.
All right, thank you all very much. And thank you again to Tom Goris and the Pistons.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。